This exercise is known as supine groin stretch. To get into position, you're going to have one leg up at a 90-degree angle, like so, and the other is going to be straight out. And you want to make sure that the knee and the foot are pointed straight up at the ceiling, so you're going to use something to block the foot off so it doesn't roll out, okay? We're using a combination of a therapy pillow here and a 5-pound dumbbell. You can use a wall, piece of furniture, a stack of heavy books, or a dumbbell, okay? Anything that just keeps your leg from turning outward. You want to make sure that your ankles, knees, hips, and shoulders are lined up. So the bench or chair that your leg is on should basically bisect you right down the middle. And your arms are going to be out anywhere between a 90 and 45-degree angle with the palms up, okay? Now as far as where you're going to feel this, it's going to be a little different on everybody. Some people say they don't really feel anything at all, it's just comfortable and relaxing. Others are going to feel it in the knee and the hip and the back and the shoulders. I always tell people you're going to feel this wherever you need it the most. So wherever you're really tight or bound up, that's where you're most likely going to feel it. And it may get a little achy or sore, but that's to be expected. It's just tight muscles and adhesions in the muscle tissue coming undone. The more often you do this, it's going to get less and less as the days, weeks, and months go by, okay? So what this exercise is doing is helping promote an elongation in the hip and groin muscles here with some emphasis on the hip flexor, otherwise known as the psoas muscle. And as that releases, there's this muscular kind of chain reaction that occurs both in the upper body and the lower body. So you're helping extend the upper back and shoulders, you're helping reposition all your load-bearing joints, your shoulders, hips, knees, and ankles, as well as your head over your shoulders. Having your leg blocked out like this, you're helping remove any rotation of the upper and or lower leg. And also with the one leg up and the one leg out, you're helping promote pelvic separation. That's what's needed for us to walk properly. So our legs travel front to back, kind of like a scissor action. Because when we can't do that and the hip and groin muscles are really tight, our inner and outer thighs take over and we start to get that kind of waddling or a limp, which then could lead to all kinds of symptoms like knees and hips and back pain, things like that. Okay? So also what I want you to do while you're here, you're basically just relaxing. And at the beginning, you're going to be holding this for at least 15 minutes, if not more, depends on what it says on your routine. But at the beginning, what I want you to do is just tighten your thigh and hold it tight for a second. Basically like you're just trying to push the back of your knee towards the ground. Okay? Then relax. And I just want you to kind of test, where do you feel that contraction? Is it closer towards the knee, more towards the hip, or somewhere in the middle? And you know, there's no wrong answer. Most people say they feel it more towards the knee or kind of in the lower portion of the thigh. Okay? Then you're just going to relax. And then at the end of the 15 minutes, or as long as it calls for on your routine, you're going to do that test again. Now, ideally, that contraction has moved north towards the hip. The reason being is that you can't feel a tight muscle contract. So the reason most people feel it down lower is they're so tight in the hip and groin area that those muscles are already tight, so they can't feel them contract. But 15 minutes or so later, after lying here and letting those muscles relax, they go to tighten their thigh again, and they can feel that contraction higher up towards the hip, okay? So that's pretty much what to expect. As far as common mistakes, things I see people do wrong, is they just try to do something. They either try to hold that thigh tight the whole time, which you don't want to do. They try to hold the leg in and maybe not use any support, which you don't want to do. They maybe try to push the lower back to the floor, pull their shoulder blades back. Those are some of the common things I hear. And you don't want to do any of those. I always tell people, if you're trying to do something in this exercise, you're already doing it wrong. Just relax. Don't do a thing. You put your body, assuming you set your body up in the right position, like we have here, that's it. Your body is smart enough and it'll take care of the rest. But if you really, really want something to do, something that'll help aid in what we're trying to accomplish here, you can do what I call east to west breathing. So that is inhaling and exhaling through the nose. And when you inhale, I want you to try to keep the air here to the side. So when you inhale, on your inhales, it's going to expand out into my hand like a balloon filling up with air. And then when she exhales, it's going to shrink back in. So you're breathing into the sides, into your lower back. When you do so, that's engaging your diaphragm muscle, your main breathing muscle. And that ties into not only your lower back, but into your pelvic floor, into your hip flexor, or otherwise known as your psoas, which is a major hip and groin muscle. So again, if you really need something to do, that will help facilitate the changes we're looking to get here. So you're going to hold one side for, like I said, it's going to probably say 15 minutes on your routine, maybe more, and then you would switch sides and repeat the same on the other side. Okay? Then move on to your next exercise if you have one after this.